When I was early in my career, I was a family physician at a community health center in Colorado, and I was really interested in learning how to do care differently in a health center. And we had a particular problem we were trying to solve, which was access to health care for patients who needed timely care. We had full schedules, a lot of demand for appointments, and not a lot of appointments. And when our babies were born, we wanted to see them within 48 hours, if at all possible. And so we decided to try something different. After clinic was closed, we opened up our waiting room and scheduled all of our newborn families to come in after clinic. And my first experience was we had a really good show. People came because they wanted to make sure their babies were fine. The timing was good. And I have Spanish-speaking patients, and my team was there, a nurse and a medical assistant to help me. But the first experience was pretty chaotic because I'm a provider who was used to doing one-on-one visits and having things go a certain way. And it was very challenging to take care of 8 families with newborns and to ask all the questions I was used to asking and to provide the care and the exams I was. And I accomplished that, and I was focused on trying to engage the group and ask questions, which there was lots of conversation in Spanish, which is not my first language. So it felt quite chaotic. And after the group, I felt a little bad, like it hadn't gone like I really wanted it to, because I hadn't accomplished what my goals were in every case. I'd missed getting a test on one baby, and I'd missed following up on a particular issue. So I went through all the list of patients, and I called them, and first of all, I was feeling apologetic because I didn't think that it had gone well. From my perspective, it felt really chaotic. And every patient I talked to said, "That was such a great experience, when can we do it again?" And so I realized that what my agenda was not really necessarily what was important to the patients and the families, and that they had a very different idea of what their ideal experience was, and that community that was building among those new moms and their infants was very important to them. And they really enjoyed the ability to connect and to ask questions together and to hear each other's questions. And that really inspired me to pursue some of the work I've spent a lot of my career doing, is creating opportunities to take care of patients in groups, which has been a really wonderful experience for me as a provider, and hopefully a wonderful experience for my patients.